Welcome back. The Alabama Supreme Court has ruled that frozen embryos can be considered children under state law, a decision critics say could have sweeping implications for fertility treatments in the state. The decision was issued in a pair of wrongful death cases brought by three couples who had frozen embryos destroyed in an accident at a fertility clinic. Justices citing anti-abortion language in the Alabama Constitution ruled that an 1872 state law allowing parents to sue over the death of a minor child, quote, applies to all unborn children, regardless of their location. Joining us in studio to speak more about this ruling is a maternal fetal medicine physician in New York and a fellow with Physicians for Reproductive Health, Dr. Erinma Ukoha. Doctor, thank you so much for joining us today.
Of course, thanks for having me. So excited to talk to you and your audience about this.
Thank you. So to start off, can you provide a brief overview of the recent ruling in Alabama that considers frozen embryos as children under state law?
Yeah, no, thanks for that question because I think a lot has been going on in Alabama, like you summarized, and it's important to consider this recent ruling in the context of everything that's been going on with abortion restrictions and anti-abortion laws. So on February 16th, the Alabama Supreme Court ruled that frozen embryos have the same right as people in the state of Alabama. And we immediately saw the impacts of this as IVF, in vitro fertilization, clinics closed, and patients no longer had access to that care. Then subsequently, on March 6th, the Alabama legislature then passed a rule protecting providers, protecting physicians who perform assisted reproductive technology from prosecution, from criminal prosecution or civil legislation as it relates to providing this care. So providers who perform IVF are protected, but at the same time, the rule still stands that embryos have the same right as individuals do.
So when it comes to this issue, can you tell us a little bit more about where do Physicians for Reproductive Health enter this conversation?
All right. So Physicians for Reproductive Health, also known as PRH, is a physician-led advocacy group that focuses on using the voice of medical providers, physicians, to advocate for reproductive health, reproductive rights, reproductive justice. And we know that this passing in Alabama is all based on anti-abortion rhetoric. It's the same playbook. They've been using it for decades, and now we just see the implications directly as it relates to fertility care. And so as Physicians for Reproductive Health, we believe that individuals should have the right to make decisions regarding their bodies, regarding their families, based on what they feel is best and with the support of medical providers, not restrictions imposed by state laws.
Absolutely. And can you tell me, from a medical perspective, what implications do you see in designating frozen embryos as children?
Right. It's concerning from a medical perspective because it's not based in science. There's no evidence that supports that, and we know that it's not about patients, it's not about individuals. This comes back to lawmakers wanting to have control over people's bodies, trying to control anything from abortion to now fertility access. And we know that it's based on this concept of fetal personhood. And so that's been used time and time again to criminalize pregnant individuals and to place abortion restrictions.
Yeah, and we're kind of seeing this fear being taken over with autonomy potentially being taken away with things like abortion and IVF restrictions. And this fear is also playing into women seeking reproductive health care, not just in Alabama, but on a broader scale. So how does this ruling affect that?
All right. And from a broader standpoint, the ruling just shows the climate, the political climate. And it shows that that same anti-abortion rhetoric is now impacting all of reproductive health. And so it's going to increase surveillance of people who try to use, whether it's IVF, whether it's access abortion, access pregnancy care. We're talking about increased surveillance for these populations, and we know that particular populations are always surveilled by the state with more scrutiny. And so that's Black and brown communities, individuals who use drugs, people from low income communities, and so those people are at even further harm.
And so also, how does this ruling, while we're talking on a broader scale, how does this ruling impact individuals' autonomy over their reproductive choices?
Right. It's a shame because this ruling really negatively impacts that. If you're not allowed to decide when and how you want to have a family, the right to have a family, the right not to have a family, this is infringing on your reproductive rights, on your human rights, on your rights as an individual.
Yeah. it's just such an insane topic to talk about when you think of these are things with my body potentially being taken away from me. It's, it's scary. It really is. And so, given your role as a maternal fetal medicine physician in New York, can you speak to the potential impact of the Alabama ruling that it may have on women's reproductive health within the state of seeking IVF treatments?
Right. Thankfully, New York is a protected state, so we have a government, we have lawmakers that support our right to bodily autonomy, and we see that the legislation reflects that. But I think more broadly, it speaks to what is a focus on a national level in different states at a time where the U.S. continues to have worsening health outcomes, at a time where maternal morbidity, mortality is on the rise, where we see more abortion restrictions being passed, and now the focus is on frozen embryos and different ways to restrict that. I think it shows that Alabama doesn't have the well-being of their citizens at mind.
Yeah, absolutely. And when it comes to approaching these conversations with patients in New York about these types of rulings, how do you help ensure that they are informed and supported in their reproductive health decisions?
My main role is to make sure patients are, like you said, informed and supported. So make sure that they're educated, a lot of reassurance as it comes to New York and what's available and what's protected, and a lot of also empathizing with that legitimate fear as people think about what might change, what's to come, how does this affect how I decide to build and plan for my future family. So it's a lot of discussions about that and just trying to meet people where they're at and make sure they have an understanding of what's going on and what it means.
Yeah, I like how you brought up kind of having that sympathy and that empathy, because sometimes as doctors, there's maybe this idea that, you don't get too close, you don't get too attached. But at the end of the day, when this is coming to people's lives and people's autonomy, you can only help but so much, and you can only feel, you can only detach yourself so much, because you begin to put yourself in that person's shoes. And what if that was me? What if these decisions that I do not want are now being, forced upon me?
Right.
So I think that that's a great idea to have, and a great method of speaking with patients. And so, with that, what advocacy initiatives or strategies can be employed to challenge rulings that may impede reproductive rights, and how can medical professionals contribute to these efforts?
Now more than ever, we're seeing the importance that abortion can't be siloed off. It can't be seen as separate from reproductive health, because those same tactics, those same rhetorics are used to control access to all sorts of reproductive and sexual health. So, that's from abortion, from pregnancy care, contraception, miscarriage, and fertility. And medical professionals, we now more than ever, have to just speak up. Yeah. Speak on a local, state, federal level, and talk about why this is important and why this matters.
Absolutely. And how do you prioritize and center the experiences and voices of patients in shaping advocacy strategies and initiatives?
So patient voices and experiences in particular are always at the center of this. I think we can't do this work without being in meaningful relationship with individuals, without engaging community and really understanding what the needs are. And so as we discuss how do we move forward, how do we better the care, and how do we get people what they need, it's all about lifting up the voices of those that are most marginalized, making sure that they have a platform.
Absolutely. And when it comes to these voices, can you kind of just give us maybe just an overview of what are some of the conversations being had, amongst people? Like, what are people's fears? What's the kind of feedback that we're hearing?
From a patient perspective, a lot of what I'm hearing is, first it was abortion and people having to travel out of state to get that. Now it's IVF and fertility care. Yeah. What else? What comes next? I think it's a fear of the unknown and looking at what's being targeted as it comes to reproductive and sexual health care.
Yeah. And so how can healthcare organizations ensure that their services are inclusive and sensitive to the needs of individuals from diverse backgrounds, including those who may be directly impacted from restrictive legal measures?
The first step is always listening to, like you said, to those most impacted, making sure listening and being sensitive and figuring out how do we close that bridge and get people the resources and the access that they need. And a lot of times it's also reflecting on what's the harm and the violence that's perpetuated by the healthcare system as an agent of the state. These disparities, the inequities that we see in healthcare are not happening in a silo either. And so how do we begin to undo that harm and mitigate that harm in communities that are affected the most? So low-income communities, Black and brown families.
Absolutely. And let's talk about how can education play a role in countering anti-abortion rhetoric and fostering a more comprehensive understanding of reproductive health decisions?
Education is going to be the first step to seeing that what tactics are at play, what the anti-abortion rhetoric is, and the agenda, and understanding and putting it into context to what's going on now. And so I always want to make sure patients and providers alike are well informed, have an understanding of what's going on, and understand what could come next. And that's important as we try to gain back these reproductive rights, try to stop policies that infringe on reproductive justice.
And what are some of the resources that people can look at to help educate themselves?
Physicians for Reproductive Health is a great resource. But we always have up-to-date information about local, state, federal rulings, and I think just staying in contact with locally what's going on from local elected officials, and then on a national level, there is definitely a lot. So the nice thing about PRH is that all that as it relates to reproductive health is consolidated there.
Absolutely. And can you also just tell us, looking ahead, what strategies do you think will be crucial for medical professionals and advocacy organizations to safeguard reproductive rights and autonomy in the face of evolving legal landscapes?
As we're working together on this, and I think it's always done in collaboration with community, understanding that we have this shared goal, and then figuring out how can, as physicians, we use that position of privilege that we have to then speak up, say abortion, make sure abortion is at the forefront of those conversations. Whether you provide abortions or not, understanding that it's part of sexual and reproductive health, and that's important to all people.
Absolutely. Dr. Ukoha, this is such an important conversation to have, right? So I want to thank you, just for sharing the resources, sharing where are some different places you can get educated. And I think this alone in itself was a very educated conversation. So thank you so much for that. And thank you for joining us today.
Thanks for having me. More than happy to be here.
Of course. So to learn more about the work that Physicians for Reproductive Health does, please go to their website at www.prh.org. Stay tuned. We have more open for you right after this.